To the end of our first hour. In our second hour, you got to stay tuned because now we're going to talk more specifically about specific ways of dealing with treatment and what kinds of treatment work best with what kinds of disorders. My guest will be Jeffrey Wood, a clinical psychologist. He'll be joining us just briefly. I'm Dr. Michael Aronoff. You're listening to Dr. Radio and the Psychiatry Show. Every day. Joining me now in the studio is Dr. Jeffrey Wood. He's a clinical psychologist in private practice and the co-author of Therapy 101, a brief look at modern psychotherapy techniques and how they can help. His previous books are Getting Help and the Dialectical Behavior Therapy Skills Workbook. Jeff, thank you for coming and welcome.
Thank you. It's a pleasure to be here.
So let's follow up with our previous hour, for that matter. I mean, you were listening, outside the studio to the show, and you had some thoughts about.
I was waiting to jump in there. Your last guests were fantastic and had a lot of great recommendations for your listeners. You were talking about anxiety, and your last guest gave a great description of breathing technique. And again, I use that with pretty much all of my clients because it's a real simple way to just learn I would emphasize slow, rhythmical breathing rather than deep breathing. We certainly don't want people to hyperventilate.
And pass out from dizziness.
Exactly,
right.
Especially if they're driving.
Right.
But usually what I recommend for my clients is to inhale for a count of 3 and exhale for a count of 4. So a very slow breath. It doesn't have to be deep, but just to slow it down.
But the difference is that the exhale takes longer.
The exhale, yes. Well, there's reasons for that, biological reasons. When we inhale, it stimulates the sympathetic nervous system a little bit, which is that fight or flight sensation. And when we exhale, it stimulates the parasympathetic, the rest and relax part of the nervous system. So if we exhale a little bit longer than the inhale...
You're putting more emphasis on that.
Exactly.
I, for many years, been a long-time student of various forms of martial arts, and part of that has always involved a combination of either meditation and or breathing exercises.
Definitely, yeah.
And it's been very important and always was part of the practice because it helped not only focus your attention but also empty your mind to some extent. But the one thing that I didn't realize at first, and it took a long time, and I would assume when you deal with patients with regard to breathing exercises, it takes practice. It's like learning to play tennis or the piano. It's not something you just pick up just automatically.
And it feels, in the beginning, when a person starts breathing in this slow, rhythmical way, it can actually feel a little scary. Because if there's a condition known as chronic hyperventilation syndrome where people just regularly take short, shallow breaths, and the body makes biochemical adjustments in order to make sure that your pH level and all that is within balance. So when a person starts to take slower, longer breaths, it can feel very strange. And as you said, it does take practice. One of the things that I do with my clients is a technique called biofeedback, where I can hook them up to a machine and they can see how their nervous system is responding to this type of breathing. And in the beginning, it does feel weird, but after a while, you can actually watch how your nervous system slows down. Mm-hmm. And we know from research, especially research on mindfulness techniques and people who meditate a lot, that there are certain parts of the brain that light up when we're anxious. But using mindful breathing and other types of mindfulness skills, we can actually train the brain to light up the other parts that make us feel happy.
So let's talk about mindfulness because we hear it more and more these days. What does it mean and how does it apply?
Mindfulness, there's a lot of mindfulness techniques. Mindful breathing is probably the easiest one. And it does come out of a lot of Eastern traditions like Buddhism, where for thousands of years they've been mindfully breathing, and now Western science comes along and says, hey, yeah, it is good for you. Thanks a lot. But
sometimes it takes time for us to catch up.
What's 2,000 years between friends?
Right.
So mindful breathing is kind of the basic. And what it is training yourself, teaching yourself to focus on one thing. Like you said, in today's 21st century society, there are so many things going on. There are so many things that are clamoring for our attention and distracting us and making us feel anxious that it's hard to focus. And so a lot of mindfulness techniques are basically that, focus exercises.
I want to share with you, maybe you would agree with this, but there was an example of what it's like to teach yourself to meditate, to clear your mind. Now, for those of you who are listening who have never tried it, you're not going to know what I'm talking about, but I'm talking about it in any case. And it's a very difficult discipline to learn how to just close your eyes and keep your mind clear of things. And the analogy that was taught to me at one point was, it's like paper training a puppy. A new puppy comes into your house. How do you paper train a puppy to do his thing on the paper in one particular place? Well, you put the paper down, you put the puppy on the paper, and the puppy goes wandering off. Well, you bring the puppy back to the paper,
yes.
And the puppy goes wandering off in another direction, and you bring the puppy back. So that under those circumstances, it's just like you're trying to train your mind, paper train your mind in a sense. Your mind goes wandering off, you bring your mind back to it. Okay, enough of that. For those of you who aren't practicing it, you don't know what I'm talking about, so it's
But it's an excellent technique for, as you were talking about earlier, for anxiety. And even if you take 30 seconds, literally 30 seconds out of your day or a minute out of your day to just sit quietly in a room where you're not going to be disturbed and just focus on your breathing, I guarantee you it will make a difference in your day.
I hope nobody's offended by this, but that means even at work, you can go into the men's or the women's room and sit in a stall just for a few minutes.
I recommend that to my clients all the time.
Oh, is that right?
Definitely,
okay.
Yeah. Or in their cars when they're driving home, or if you take the train, sitting.
Pull over in the car and
pull over in your car, or if you get really good at it, once you get good at it, you can even mindfully breathe while you're driving and be a calmer driver.
All right. Now, look.